So many things trigger me every day, things that people wouldn't normally be influenced by. I start my day just like any other 17-year-old girl in high school, thinking about what I should wear, what makeup I'm gonna do, and what shoes I'm gonna wear, but I usually just end up wearing baggy clothes or something very non-form-fitting. I don't want people to judge me for my body and my appearance. I spend my entire day thinking about my appearance, constantly checking how I look in the bathroom, on my phone, or any reflective surface that I walk by to make sure that I fit their standards. I have a bit of OCD. I have to constantly fix my hair, eyebrows, and anything that is out of place and flawed according to their standards. Every day I'm consumed with thoughts. Sometimes I feel like I'm drowning in them, constantly overthinking everything I do and what others are thinking of me. It's like I'm trapped and I can't escape. My name's Alyssa. I'm 17 years old. I've been trying to escape this illness of anorexia since I was 14.
Up to 24 million people of all ages and genders suffer from an eating disorder in the U.S. 95% of those who have eating disorders are between the ages of 12 and 25. Eating disorders have the highest mortality rate of any mental disorder. 20% of people with anorexia will die from complications related to their eating disorder, including suicide and heart problems. Almost 50% of people with eating disorders meet the criteria for depression. 86% of college students report onset of an eating disorder by age 20. 43% report onset between ages of 16 and 20. Anorexia is the third most common chronic illness among adolescents. 25% of college-age women engage in binging and purging as a weight management technique. And how can you really blame them? Let's take a look at how the media puts unrealistic expectations in our heads since we were little. This is not realistic, nor will it ever be. Barbie has a 16-inch waist, 29-inch hips, and a 16-inch thigh. To put that into perspective, the U.S. average waist size is 35 inches, hips 40 inches, and thighs 25 inches. If we want to look like Barbie, this is what we would look like. And yes, this is a real person. We are being poisoned with what we should look like since we were little kids. Then into high school and college, we were surrounded by what the ideal body is. From models, actors, and actresses, and ads or stores, and how to achieve their perfect bodies through weight loss pills, dieting, and workouts. When in reality, these people don't even look how they do in these commercials or ads. It's things like this that are giving unrealistic expectations to millions of people worldwide. And more people are affected than you think. Early detection of eating disorders are crucial. If a friend is exhibiting behaviors such as not eating as much as usual, excessive working out, making excuses not to eat, looking thinner, constantly checking appearance, distorted body image, avoiding situations involving food, social withdrawal, obsession with dieting, depression, and anxiety, they may have an eating disorder. And there's a few things you can do to stop it from developing into a bigger problem. Approach them on a one-on-one level, show that you care. Be a support system for them, someone to confide in. Suggest they go talk to someone. Tell them how it affects their friends and family.
Things that helped me on my road to recovery were after seeing how much it affected my friends and family, I knew how it made them feel. When I was hurting, they were hurting, so I decided to help myself. People who suffer from eating disorders will only recover if they want to recover, but until then, 10 therapists, bottles of medications, inpatient, outpatient treatment, it won't help them. They have to want it for themselves, and I wanted it. I stood up to my eating disorder even though I was scared. I did it because I wanted to put a stop to this vicious cycle. It was destroying my life. I recovered by going to various treatment centers that show me the dangers of what an eating disorder can do to you and your family. Also, the main staple in my recovery are my friends and my family. They've supported me through these crazy 3 years. I'm grateful to have them. For anyone who's suffering from this terrible illness, please reach out to someone you trust. You're not alone in this battle, and you can win.
Some tips for the road to recovery and early detection on campus is University Health Services, which has CAPS, or Counseling and Psychological Services, which provides one-on-one counseling, crisis intervention, and psychiatric services. Also, NEDA, or the National Eating Disorder Association's website, has various tools to provide help and support. NEDA also has a ton of information and resources about eating disorders. Lastly, talk to your friends and family. The longer an eating disorder goes untreated, the more advanced it is likely to become, and the more difficult it will be to achieve full recovery. Size does not equal beauty. Everyone is beautiful no matter what size.